Hello, hello. How are you all? I hope you all are having a wonderful day. My name is Leticia Yarbrough. I am founder of iRise Wellness, and we have a lovely guest here today, Dr. Williams. If you can introduce yourself and just tell us who you are.
Yes, Leticia, thank you for having me. My name is Dr. Shantae Williams, and I am a physical therapist who specializes in treating the pelvic floor muscles, which I'll get into in a minute what those are. I've been practicing for about 13 years, and I recently relocated to the Atlanta area from Chicago. So I'm now serving the greater Chicago area. And
The
so.
greater Atlanta area, right?
Oh, did I say greater Chicago area?
Chicago area.
The greater Atlanta area. See, that's how much I miss Chicago, but Atlanta is great. I love it here. And I'm serving down here now.
Okay, well, tell us what the pelvic floor is.
Yeah, so I'm going to share my screen so we can just take a look as I talk about what the pelvic floor muscles are. So the pelvic floor muscles are they're the floor of our core. So they lie on the floor of the pelvis, right? So they attach from the pubic bone all the way to the coccyx, and then they attach from sit bone to sit bone. So they form a hammock of muscle, and they support our pelvic organs, right? And they stabilize in our spine and our pelvis, and they play a huge role in bowel, bladder, and sexual function. So if you take a look at this picture here, you can see, so just to point out, like this is the pubic bone right here, this is the tailbone, and this is this person's hips, okay? So those muscles span the whole entire bottom of the pelvis, and the superficial muscles you see kind of form a figure eight around the rectum, your vaginal opening, and then your urethra, which is right here. And then just to give you more perspective, this is the clitoral head, so the glands of the clitoris. Just an FYI, the clitoris is not just here. I'm pointing this out because a lot of people do not know this. But the clitoris is not just here. It actually goes down like a wishbone. So if you remove all of these muscles, it actually is very similar to the anatomy of a penis. It's just a little bit smaller. So that was a little tangent. But these are the pelvic floor muscles. And then here, this bottom picture is just another view. So you can see the bony pelvis right here. And you can see the bowl of muscle that sits inside the pelvis. Okay. So if you think about your core muscles, which a lot of people are familiar with, you have the pelvic floor on the bottom of the core. And then you actually have a very important muscle, the diaphragm, which is your breathing muscle that sits on the bottom of the rib cage. So you have your pelvic floor here, your diaphragm that sits on top. So if you think about like a cylinder of support, and then you have your transverse abdominis muscles, your abdominal muscles in the front, and then you have your deep back extensors in the back. So all of those muscles work together to form your core, which is super important, as we know for at least we know it's important for like our spinal support. So those are the pelvic floor muscles. So I think it's important that we are aware that we have these muscles. I'm going to stop sharing my screen. I think it's very important that we are aware that we have these muscles because a lot of us don't know, right? And they play such an important role in a lot of our bodily functions, specifically bowel, bladder, and sex, which are all super important, right? Those are things that we do, mostly those are things that we do every day. But it also gives us support. It's like our foundation.
Yeah, and we talked about personally, we talked about a little bit before, but why would this be important to the Black community? How does this impact our Black community?
So anyone who has a pelvic or anyone who has a pelvis has a pelvic floor, right? And pretty much a lot of people are unaware of these muscles, right? So if you talk to like your friends or people in your community, a lot of people don't know that the pelvic floor exists. A lot of people don't know that my profession, pelvic floor physical therapy, exists. And this is even more so in the Black community. I do see that I don't see as many Black patients coming in, right? And the people that I talk to who are more aware of it just happen to be people who don't look like me, right? Like they've maybe been to like their gynecologist and their gynecologist referred them to pelvic floor physical therapy, or they have friends who have been through pelvic floor physical therapy. They're more aware, right? And like my Black brothers and sisters and my family members, like they have no idea. They have no idea. And also, like, there's not a lot of people in my profession that look like me. So I think it's definitely lacking in the Black community.
Yeah, absolutely. So some of the patients that you see, what are some of the things that they come to you for?
So I personally specialize in chronic pain and sexual dysfunction, but I do see all pelvic health conditions. So if you have a pelvis, again, if you have a pelvis, you have a pelvic floor. So it can happen to pelvic floor dysfunction, can happen to all genders, right? I see men, I see women, I see there's pediatric pelvic floor. I don't personally see children, but I see people probably around the ages of like early 20s to maybe 60 or 70. So it does span across, all ages. And we definitely see people who, pregnancy and postpartum. I specifically see patients who have endometriosis. So that's another thing that a lot of people, especially in the Black community, don't know about is endometriosis. I see a lot of people with endometriosis, which can cause like debilitating pain, bowel and bladder issues as well. Whoa.
Yeah. So you talked about chronic pain, and you talked about endometriosis, and you talked about sexual dysfunction. For people that are not aware of some of these things, can you give a little bit more background to what chronic pain would look like? What is endometriosis, and what is sexual dysfunction exactly?
Yeah. So a chronic pelvic pain can happen in the pelvis, obviously. So that can create pain with sexual activity. So arousal and orgasm, penetrative sex. Because if you look back at that picture I showed you in the beginning, those muscles surround the vaginal opening, right? And they surround all of like the sexual organs. So it can create pain with sex. It can also refer to like the lower back, the abdomen. I've seen pelvic floor pain refer down the legs. So it can happen anywhere surrounding like the pelvic girdle. Endometriosis specifically is a condition where you have abnormal cell growth, very similar to like the lining of the uterus, but not the exact same cells, grow really anywhere in the body. Most commonly in the pelvic and abdominal cavities, but it can grow anywhere. So we've seen endometriosis adhesions in the lungs, the diaphragm, the thoracic spine. And if you can imagine like these adhesions sticking to things like our reproductive organs or our guts or a gut or a bladder, it can really cause a lot of issues, right? Like pain with bowel movements or, like I mentioned before, pain with sex, really a whole like gamut of things. And then specifically like bowel and bladder issues that we commonly see: urinary incontinence, urgency, frequency, bladder retention, constipation, bowel frequency, things like that.
Yeah, absolutely. And you talked about ways that you can help kind of make your body aware and just really aware of your pelvic floor is breathing exercises. How does breathing exercises help? And then could we walk through a possible breathing activity?
Yeah. So your diaphragm actually moves with your pelvic floor. So if we think about the way that the core is set up, you have your diaphragm on the bottom and you have your pelvic floor on the bottom, and you have your core your diaphragm on the top. So they do this dance and they like piston together, right? So when the lungs fill with air, your diaphragm and your pelvic floor descend. And then when you breathe out and your lungs empty, your diaphragm and your pelvic floor go back to that starting position. So just by doing diaphragmatic breathing, you can move the pelvic floor. And if you're practicing this and you're not distracted, sometimes you can even feel that movement of the pelvic floor. So the diaphragm and the pelvic floor very important relationship. And just by doing breathing, you can mobilize your pelvic floor.
Well, let's mobilize our pelvic floor. I would love to see what that would look like. If you could just walk us through it, and I will do it with you.
Yeah, sure. So if you look at babies or toddlers, you'll see the way that they breathe is from their bottom half, right? So we kind of lose that over time for whatever reason, posture, age, we start to breathe with our chest. So diaphragmatic breathing is intentionally just trying to breathe with your bottom half. So breathing into your pelvis. Okay. We call it belly breathing, but it's not really belly breathing because you're not just like breathing with your belly, right? You're really breathing with your whole entire half. So I actually like to pretend like my bottom half is a beach ball or a balloon. And when you inhale, you should feel that 360-degree expansion. Okay, so I'll usually cue my patients to place one hand on their chest and one hand on their abdomen for some feedback. And I'm just going to reposition my camera here so you can maybe see me. Okay. So place one hand on your hand and then one hand on your lower abdomen. And then when you breathe in, you shouldn't really feel your top hand moving. All the movement should come from your bottom half. So you're breathing into your abdominal cavity, into your pelvis. So go ahead and inhale and feel that expansion. And then when you exhale, you should feel that lower half deflate. So it should really feel like a relaxed, quiet breathing technique, right? You shouldn't be like forcefully using your other muscles. And another thing that this does is it regulates your nervous system, which is important, of course, for like stress, anxiety, sleeping, stuff like that. We know that breathing this way slows down our heart rate, which helps with our parasympathetic response, which is the side of our nervous system that regulates our stress hormones, and really like calms us. That counteracts that fight or flight sympathetic response.
Yeah, that's wonderful. Is there anything that activities that people can do? You maybe embedding this breathing exercise. I'm thinking of like maybe like a yoga or a meditation. What are some activities that you encourage your patients to do?
Yeah, so yoga and meditation are great because they do focus on the breath, right? So you're definitely incorporating diaphragmatic breathing when you're doing those activities. I'll just tell people to practice it. It is a form of mindfulness. So a lot of times when people think about mindfulness, they think, okay, I have to meditate to music or like a guided meditation for like 45 minutes. Just focusing on your breath is a form of mindfulness. So I'll tell patients to, like in moments of stress, or if they're driving in like Atlanta traffic, do 10 deep calming breaths and see what it does to relax not only your pelvic floor, but the rest of your muscles and your nerves. It's really, really calming. It's something that I do often throughout the day. But yes, to practice it daily, maybe like first thing when you wake up, take 10 deep calming breaths. That's a way to like set your day up to run a little bit more smoothly. But yes, you can incorporate it really with anything.
Absolutely. So this is great. So for people, you talked about there's not a lot of folks in your field that look like you. So for people, we do a summit for high school students, our little service projects, and maybe they'll be watching this. So our future doctors out there, could you tell them what exactly your profession, how to get a part of your profession? What do they need to know if they're pursuing to wanting to be a doctor one day?
Yeah, so a physical therapy program, it's a doctorate program, and it is a 3-year program. So that's on top of your undergraduate degree. So I would, if you're looking at a specific school, you can simply just go to their website and see what prerequisites they require. But if you're in a science major for undergrad, then you most likely are hitting a lot of these prerequisites. But based on like what school you want to go to, there are PT schools that require genetics, for example, and there are some PT schools that don't require that. So definitely just looking at what set of prerequisites you need to get into the program. And then also, I think mentorship is super, super, super important. So more and more you are seeing Black women, even Black men go into pelvic floor physical therapy. So we're out there. You just have to find us. So social media is, I think, really blowing up. A lot of us are out there advocating for pelvic floor physical therapy and like educating the masses. So we're out there. I have like some great pages that if you're interested, I can give you the handles to follow, but they're really great, like Black pelvic floor physical therapists. So I think mentorship is super, super, super important. And yeah, I reach out to me if you have any questions. I'm more than happy to help.
Yeah. So how can people find you?
And so you can email me. I'll leave my email address with Leticia. And then you can also, I do have an Instagram page as well. That is Dr. Tay_PT. And I do a lot of education on there as well. And you can also direct message me on there. But yeah, email or Instagram.
All right. And if they are looking for a pelvic floor office that they want to be referred to and they want to find you in the Atlanta area, where is your office located?
So I'm in the Sandy Springs area, and I'm working at a private clinic called Able Pelvic Health. So I am more than happy to help you out. I also work with some amazing colleagues too, who are very knowledgeable. If you are looking for a pelvic floor physical therapist and you do not live in the Atlanta area, there are ways that you can find one, just searching based on like zip code or your city, your state. Those websites I can also link as well. I can give you those websites a little bit later. One that I know off the top of my hand is pelvicrehab.com. The other one I don't know by heart, but I can give that to you to pass along.
Okay, perfect. So anything that you want to leave people as we close out this conversation today?
Yes. So know your pelvic floor. If you are having like any of the symptoms that I mentioned, just know that there's help out for you. Like pelvic floor issues can be very isolating. We don't like to talk about them, right? Because it's kind of embarrassing to talk about poop or pee or even sexual health. Like we don't really talk about that. It's considered taboo, but just know that if you are having any of these symptoms, there's help out there for you. You don't have to live with those symptoms. And just for like general wellness, keep doing your deep breathing, become more and more aware of those pelvic floor muscles. I think practicing mindfulness really helps to maintain an awareness and go into pelvic floor PT because it's a very rewarding profession to all my young people out there who are interested.
Awesome. Well, thank you so much. I hope this information found you well, and we will see you soon. Have a good day.
Thank you.